gather all equipments, check medication order against original physician's order according to agency policy, clarify any inconsistencies, check the patient's chart for allergy. Consider the appropriateness of medication for the patient. Perform hand hygiene. Move the medication cart to the outsides of the patient's room or prepare for the medication in the medication area or nurse station. Unlock the medication cart or drawer. Prepare medication for one patient at a time. Read the medication administration record and select proper medication from the patient's medication drawer or unit stock. Compare the label with the MER, check expiration dates, and perform calculations if necessary. When all medications for one patient have been prepared, recheck the label with the MER before taking them to the patient. Replace any multi-dose containers in the patient's container or unit stock. Lock the medication cart before leaving it. Identify the patient using 3 methods and compare information with the MER. Check the name and identification number on the patient's identification band. Ask the patient to state his or her name. If the patient cannot identify him or herself, verify the patient's identification with a staff member who knows the patient for the second source. Complete necessary assessments before administering medication. Explain the purpose and action of each medication to the patient. Perform hand hygiene and put on gloves. Provide patient with paper tissues and ask patient to blow his or her nose. Have the patient to sit up with the head tilted well back. If patient is lying down, tilt head back over a pillow. Draw sufficient solution into a dropper for both nares. Do not return excess solution to a stock bottle. Ask the patient to breathe through the mouth, hold the tip of the nose, and place the dropper just above the nares, about 1/3 of an inch. Instill prescribed number of drops in one nares and then into the other. Protect dropper with a piece of soft tubing if patient is an infant or young child. Avoid touching nares with the dropper. The patient remain in position with head tilted back for a few minutes. Remove gloves and perform hand hygiene, and assist the patient to a comfortable position. Evaluate patient's response to the procedure and medication. Document procedure into the patient's chart.